morning, ladies and gentlemen. This is your host, Annalise Garrison. I just got done a tutoring session, and per request, I'm going to make a video, how to eliminate answer choices on the NCLEX. There's 4 strategies I have, and this is one of them. So let's get started. Okay, so this strategy works the best when you answer assessment questions. If you see the word first, if you see the word assess, or if you see the word first assess, then you want to use this strategy. And that is, you want to stay in the now, not the past or the future. Now let's take a look at an actual NCLEX question that I wrote and see how this strategy works in action. The nurse is assigned as a preceptor to a newly hired nurse. Which of the following, if performed first by the newly hired nurse, would indicate his or her ability to prioritize? In this question, we only have the word first. So, stay in the present, not the past or the future. So let's look at A. Obtaining a blood glucose level with a client with a history of hyperglycemia who recently returned from surgery. This would be the past. Because of the word history, that makes it a past, but also who recently returned from surgery. So returned, ED, is past. Let's look at B. Performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. This is the present because of the word performing and because of the word reporting. Performing a neurological check on a client with primary hypertension who is reporting. That is the present. C. Assessing the pain of a client who had a thyroidectomy 2 hours ago and is reporting a sore throat. Because of 2 hours ago, this makes it the past. Okay? Not only that, but for the NCLEX, 7 out of 10 times pain is not the answer. But assessing the pain of a client who had a thyroidectomy 2 hours ago is past. Let's look at D. Checking for a gag reflex of a person who returned from surgery 15 minutes ago from a bronchoscopy and is NPO. 15 minutes ago is the past. Checking for a gag reflex of a person who returned from surgery 15 minutes ago. So, let's look. A is the past because with a history of hyperglycemia who recently returned, past tense, right? B is now, performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. That's happening now. C is past because of 2 hours ago, and D is past because of 2 hours ago. So the answer for this question would be B. So don't forget, ladies and gentlemen, when answering the NCLEX questions, look at your answer choices and always choose the answer that has to do with the present. That will always be your answer choice.
I love you, Jesus.